Concussion, Chapter 13. Concussion, Chapter 13. Injury prevention for athletes. Part is probably Part 5, concussions. The Centers of Disease Control estimates that there are 16. The Centers of Disease Control estimates that there are 1.6 to 3.8 million sport and recreation-related concussions occurring in the United States each year. Many concussions go unrecognized and therefore unreported. The numbers suggest concussions are becoming an epidemic and must be acknowledged within sports. It is difficult to prevent concussions. However, they can be mitigated. The professional can provide proactive measures to prevent the severity and frequency of concussive etymology. Some organizations have taken preventative measures to limit the potential for minimizing impacts to the head through rules. These sports inherently provide potential for head trauma, regardless of rules in place. To protect the brain, the professional must strengthen the anatomy that controls the movement and positioning of the head. To mitigate concussive forces being transferred to the brain, the muscles of the head and neck segment must be strengthened. The head and neck muscles serve as shock absorbers by dampening impulsive forces and slowing the acceleration of the head, slowing the movement of the brain. This suggests that while concussions may not be prevented, the severity of the injury and resulting cognitive impairment can be reduced in the head, neck, and surrounding cervical structures are stronger. Improving neck strength will reduce the translation of excessive force to the brain through a decrease in the torque developed during concussive impacts. In a 2014 study, neck strength, a protective factor reducing risk of concussion in high school sports, Comstock et al. Found that 1 pound of improvement in neck strength leads to a concussion risk reduction of 5%. This indicates that while improvements in equipment can help with prevention of concussions, neck strengthening programs may be the best concussion mitigation. The most important goal of strength and conditioning professional is to prudently prepare the athlete for the rigors of competition. As such, developing programs that prevent injury of athletes is the most important part of the sports performance professionals. Given the increasing evidence on the ramifications of concussions and head injuries, neck strengthening should be considered an integral piece of comprehensive injury program. The sports performance professional should be able to apply knowledge and techniques in a training setting to prevent potential injury. The neck and surrounding muscular structures of the cervical spine should be sequenced first, allowing these important structures to be activated prior to the athlete fatiguing at the end of the workout. Ideally, a neck machine would be used to train the neck in all planes of motion and through all movements, including extension, flexion, and lateral flexion. For training the neck specific to concussion prevention, it is recommended stabilization protocols for resistance training are utilized. If a neck machine is unavailable, the sports performance professional may need to rely on the use of manual resistance exercise. Generally, on the first initial neck strengthening workouts, if the individual is experiencing delayed onset muscle soreness, the individual should be encouraged to complete the neck workout as outlined in its entirety. However, if the athlete experiences a high level of delayed onset muscle soreness after a long period of neck strengthening, the individual should be advised to refrain from doing any neck strengthening or any other exercises that exacerbate the condition until the soreness subsides. Caution, page 48. If an individual has trained, caution, if an individual has never trained the neck musculature, most will experience a high degree of delayed onset muscle soreness. This is normal and may last for 2 to 3 days after initial workout. Injury rehabilitation. The goal of a rehabilitation program is to return the athlete back into competition stronger than before the injury occurrence. The focus of the sports performance professional should be on the development of strength programs that will complement the protocols put in place by licensed professionals, athletic trainers, physical therapists, team physicians. The sports performance professional needs to effectively communicate with team members to ensure a holistic rehabilitation program is developed to return the athlete to play safely. During this time, it is important the sports performance professional not lose focus on maintaining the uninjured areas of the athlete. Doing so can lead to dysfunction and potential for injury to these adjacent body parts. Rehabilitation protocols. Injury rehab can be prescribed in 3 graded stages, defined by the athlete's symptomology and trajectory of recovery. Working in concert with sports medicine staff, the sports performance professional must coordinate strength training around treatment schedule. Acutely, all rehabilitation to the traumatized area is initially managed and treated by the athletic trainer and sports medicine staff. Stage 1. The sports performance professional will strengthen the non-traumatized muscles around the injury using isolateral or single limb training. Isolateral training facilitates the neural adaptations that minimize atrophy to the traumatized areas and continues to build strength in the non-traumatized areas. Stage 2. When the athlete regains pain-free range of motion in the traumatized area and is cleared by the medical staff to begin strength training, Stage 2 of the rehabilitation protocol begins. Stage 2 strength training is both therapeutic and progressive in nature. Strength training facilitates an increase in blood circulation to the traumatized area to promote healing, while returning the traumatized area to functional capacity. Joint stress during this stage needs to be minimal. Stage 3. Stage 3 of the rehabilitation protocol focuses on returning the traumatized area to baseline or greater than pre-injury strength levels. In addition to strengthening, emphasis is always directed at increasing the athlete's metabolic conditioning levels. Pain and swelling will determine the rate of training progression. Once the player's isolateral strength on the traumatized area progresses to 75 to 85% of its non-traumatized counterpart, the player can begin training bilaterally. The rehabilitation process is complete when the following criteria have been completed: pain-free movement, non-noticeable signs of swelling, reestablishes full range of joint muscle mobility, regains and or exceeds pre-injury strength levels, develop necessary level of metabolic fitness to safely participate in practice setting. Psychological effect of injury. Psychological effect of injury. Although injury rehabilitation primarily speaks to physiological damage, there is an equally important psychological aspect that must be addressed. Feelings of discouragement and disappointment will inevitably have to be managed. Athletes must be encouraged and motivated through the process. It is important that professionals redirect negative attitude toward focusing on what must be done to return the athlete to competition. By documenting progress, the professional can focus on even the small incremental improvements to instill confidence and motivate progress. Summary. While it is likely that athletes will be injured, sports performance professionals should develop programming designed to keep the athlete free from injury. This requires a knowledge of epidemiology of the injury and an understanding of prevention strategies to prepare athletes for the demands of sport. Prevention strategies are key to an athlete's health and career longevity. The influence of poor biomechanics, neuromuscular efficiencies, overtraining, and decreased flexibility contribute to injury. Research has provided evidence of preventative strategies that include integrated flexibility, proprioceptive training, strengthening a focus on proper technique, as well as implementation of progressive plyometric intervention strategies. These strategies are important to implement whether the program is designed to prevent head and neck or ankle injuries. And cut.